session, our final session of the day, we're very excited, for those of you who stuck with us to the end, is going to be on activating the patient voice for advocacy. We are going to be talking about different ways that you as a person with metastatic breast cancer, or someone who cares about someone with metastatic breast cancer, can help get money to those researchers, can help support your fellow patients, can do things to make this experience of living with this disease less awful for all of us, right? That we're all going to do this together. I'm pleased to introduce our first speaker is going to be Stephanie Ruffer, Dr. Stephanie Ruffer, PhD, who is from the Susan G. Komen organization, and she is also their representative on the Metastatic Breast Cancer Alliance, which is a great organization that's a collection of groups that are working on metastatic breast cancer issues. And so she's going to talk to us about the current issues that exist in metastatic breast cancer today. So welcome, Stephanie. Thank you, Ben. So if I can That's me. I am representing the Metastatic Breast Cancer Alliance here today. I co-chair the research task force of the Alliance with Shirley Merckx, who's unable to be here today because of a family emergency. So the Alliance, I'm not going to read, you can read, but basically we're all about collaboration and cooperation, bringing the strengths of the various organizations together to improve lives for people living with metastatic breast cancer, and hopefully get to that place where we can find a cure or cures for metastatic disease. We are up to 40 members now. That includes 3 individual members, a wide variety of advocacy members, and then a handful of industry members that support us financially so that we can do the work we do. That has happened in a very short amount of time. We started in October of 2013 with just 15 nonprofits and 3 pharmaceutical partners. So we've grown very rapidly over 3 years, and actually managed to do quite a bit in that amount of time. I mentioned that we're all about collaboration and working together. We have a number of groups in the Alliance that many would consider competitors, but we put our preferences and our opinions aside, and we come together to work to move things forward as best we can. And there are also a large number of activists and advocates working with us to help bring change about, and that's what we're going to talk about here. So the first thing that we did when the Alliance formed in October of 2013 was we decided that we needed to actually understand what the state of metastatic breast cancer research and support was. So we did a landscape analysis. And we really tried to cover the landscape of metastatic breast cancer. So we included an analysis of the scientific research that was going on, the epidemiological studies and data that was available. We did surveys and focus groups and interviews to study quality of life, information and support services that were available from all the different groups, and then also public awareness of MBC. There are copies of this out on the table if you are interested. There's not enough for everybody. There's also the executive summary, and you can also download it online. So if you're interested in looking at the full report, we can certainly get it to you. So I'm going to spend a little time talking about the research analysis that we did, because I think that's what most people are interested in, and it's what I'm best positioned to talk to you about since I co-chaired that committee. So to identify really how much metastatic breast cancer research was going on out there, we utilized 2 databases. There are 2 organizations. One is the International Cancer Research Partnership that consists of all of the cancer funding, well, it's not all, but many of the cancer funding agencies around the world. It includes the National Cancer Institute and the DoD programs, as well as other government funders and nonprofit funders of cancer research. As best we're able to tell, that database covers about 60% of the cancer research funding globally. So it's a good representation. And then it's supplemented by what's in the GRASP database. That's the database of the Health Research Alliance, which is a different sort of organization composed of nonprofit organizations that fund health-related research. So we pulled 18,000 some odd awards out of the database from ICRP and added to it the 2,000 non-duplicative grants that were in the GRASP database for a little over 20,000 grants that were analyzed. Those were grants awarded between 2000 and 2013. And we had to figure out what we were going to call metastatic research. And as patients, the patients in the room will probably say that we should have focused on treatment for metastatic breast cancer. The researchers in the room, if there are any left, will say, but there's so much more than that, so much of what we do is relevant for metastatic research. What we landed on was keyword search and coding that basically captured something in between. So we capture everything from basic biology through treatment of metastatic breast cancer, but it has to specifically be focused on metastatic breast cancer. It has to be using a model that we know is metastatic breast cancer relevant, it has to be directly looking at the process of metastasis. So we did manual coding and keyword searches of 20 some odd thousand grants, found 2,310 that were likely to be relevant to metastatic breast cancer. About 30 of those turned out to be false positives, so we ended up with 2281 awards. So that's where that 7% number that you hear comes from. Those awards totaled up to be about $1 billion in metastatic breast cancer research out of the $15 billion total that we were looking at. So what we found in those grants is, again, that about 7% of the research grants met our definition of what was metastatic breast cancer research. I agree with you, that is not enough. That's really, really sad. I do want to reiterate that this is a large group of grants. Individual organizations within that fund more or less of that. And the government funders are obviously the big contributors. Not that we all couldn't do better, but if you want to make a difference, we should probably lobby for more federal funding. The annual number and percentage of grants that were focused on metastatic breast cancer within that set really didn't vary significantly. Any given group might waffle a little bit, but overall it stayed the same. And of these grants, the vast majority of them were focused on the biology of metastasis. So 69% of those grants were trying to understand how cells metastasize. 24% were what we would call translational research, moving basic discoveries into the clinic. Another 6% were actual clinical research studies, trials, things like that. And then about 1% were focused on survivorship issues. And most of these grants that were focused on the biology were actually looking at the process of invasion or colonization, so how the cells actually move from the breast into other parts of the body and then set up shop someplace else. The idea being that if you understand that, you can treat it, but you have to understand that first. The epidemiological study, I don't think I need to tell you this, you've heard a lot about it, I feel, but we don't really have any data on the prevalence or incidence of metastatic breast cancer. There are individual institutions who count their own patients, but nationally, the databases only count de novo metastasis. So if you're diagnosed originally with metastatic breast cancer, you go into the database as a metastatic breast cancer patient. But if you're a primary early stage breast cancer patient that recurs, that doesn't get counted. That makes it very hard to know how many people are living, do studies on who recurs, and any of those other sorts of things. So that's another thing we're working on. There's a petition circulating right now, you may have seen it on social, to get SEER to count recurrence, and we're also working a couple other angles to do that. The quality of life studies, we were talking about this last night at dinner. I don't think I'm telling you anything you don't already know, but there's not a lot of support and there are a lot of challenges for metastatic breast cancer. You need, the information needs to be easy to find, the support needs to be there, the communication and decision making is so important. It's very technical information and the doctors are just not good at communicating about it. So we've done a number of things in this area as well. I'm going to talk about one of them in a minute. But we really, the first thing that was the easiest thing to do was reorganize all the information we all had, and we put together a hub on the Metastatic Breast Cancer Alliance website. So you don't have to go to 14 different sites to get information now. You can go to the Metastatic Alliance site and pull information from all the different sources. Again, this is the Patient Information Awareness and Support Services findings. We found that there's a lot of information gaps despite everything that was out there, and we're working to sort of fill those. And health literacy, we've talked about a lot. Studies are really hard to understand. It's really hard to get the information. It's very technical. So we haven't really made a lot of headway there, but we are thinking about that as well and working on ways that we can translate information for you so it's easier to digest. So after we conducted the analysis, we came up with the following 3 goals to advance research. And this is research specifically that's focused on extending life, enhancing the quality of life, and ultimately ending death from metastatic breast cancer. We have a task force dedicated to that, which I co-chair with Shirley. We have another task force specifically focused on improving knowledge and access to care. And then there's a third one that's focused on increasing understanding. And you may see we've had 2 social media campaigns, one last October, one this October, trying to raise awareness of metastatic breast cancer and what it means. Last year was focused very basically on how to stay metastatic breast cancer. It was sort of a kitschy way to get people to pay attention and then find out more. This year it's keep me in the picture. And it's a very graphic representation of too many people are dying from this disease. So I just wanted to close with 2 very specific examples of things that we've been able to do as an alliance that we wouldn't have been able to do individually. The first is the metastatic trial search. So this is something the Breast Cancer Trials was able to, the Alliance urged them to do it and actually paid for them to do the initial beta test of this. It's on currently their website and 5 member organizations' website. We've just given them another project approval to expand it into 5 more sites, and we're going to expand it on from there. But it's clearly you know about it, you've used it. I think it's pretty easy to use. You need a lot of information, but I think it's information you have access to, and it'll pull up the trials that you might qualify for. So there's another one we've done for clinical trials that I think is kind of cool. It's a bubble chart. I think somebody may have mentioned it earlier today. It's just a way to see all the trials and then dig a little deeper into each one. And then this final one is getting at the patient-provider communication. In your folders, there's a flyer about this. It's called the Dandelion Project. It's meant for providers. So we thought maybe you could take it back to your oncologist and talk to them about it. But it's a kit, it's a toolkit. There are flashcards, there's a script. It's a way for nurses or doctors to talk to patients about metastatic breast cancer and what it is in a way that's more easily understandable. And then there are cards that will help people ask questions. They can find the card that strikes them and then ask that question. It's in beta testing right now, but I think we're still recruiting more sites. So if it's something that you're interested in or your provider is interested in, let us know. You can contact me, you can contact the Alliance. So that's why we gave you those cards to take back and look at. We're pretty excited about it. So that's a real quick tour of the metastatic breast cancer landscape, but I think it highlighted some of the issues that then the panel will talk about now.